Okay, so the research that I did was looking at suicide among farmers and agricultural workers in Georgia. There are elevated rates of suicide in this population, so I was looking at what were the factors associated with these events from 2008 to 2017. Well, it was very interesting because what I found was that some of the factors are the things that one would think about in suicide for anybody. Relationship issues was a really big challenge. But in addition to that, there were other factors that I found more surprising. Perhaps the number one was health-related concerns, that for farmers and agricultural workers, getting sick, not being able to work, and being a burden was something that was tremendously stressful and associated with suicide. And if you think about rural populations and this sense of independence and this need to work and to be self-sustaining, then health is a really devastating issue. So health was one, relationships were another. The other that I saw was that there were lots of warning signs that people weren't picking up on. Maybe the one that kind of touched my heart the most was somebody called and left a voicemail with their neighbor that just said, "My wallet's on the mantle, please take care of my cows." And that was the last message they got. And the person ended up dying by suicide very soon after that. So there are these factors, but the good news is that I think those factors point at places that are points of leverage for us. So that if we know health is an issue, if we can train primary care physicians and nurses' aides and everybody in the healthcare industry that for this population, this is a real risk factor, well, that's a place where we can do an intervention. If relationship issues and relationship loss are highly associated with suicide, then we can think about things like divorce lawyers, funeral homes, nursing homes, because we saw people who, when their partner went into a nursing home, they became suicidal. All of those people can become places of intervention. And then for financial concerns, you think about bankers. And the other group that I'm really excited about is thinking about extension agents as places for intervention where you can identify, intervene, refer, and get people the help that they need.